Well, the Silhouette InstaLift, these threads that we're putting in, have little bitty cones on them right there. You can see a little group of cones. And they all face upward in this case. Now they're underneath the skin, and they'll grab hold of the skin and then allow us to lift the skin, the face or whatever that the cones are in, and put them in a position a little higher up. So it's kind of like a little mini facelift. So we go in this little pilot hole here, and the thread goes down, and then we take the same thread as another series of cones right there, and we're going to run them up the top part of the face into this skin up here that is pretty nicely anchored down. It doesn't tend to want to move much. So this skin up here, the top part of the face, acts like our anchor. And you just pull this through.
Here comes the pops.
And it makes a little popping sound. See that? Those cones all disappeared now. They're up in here. And they're going to grab onto this group, this area of skin here, and hold tight. And then later we can slide this skin up more if we need to onto those cones down there, and just lifts it all up. But usually, whenever I do this, just the process of placing those sutures in there, I pull with enough tension that it gets it pretty much where I want it to be. So we don't have to necessarily reposition later on. So you take this needle here, we've numbed up all the spots where we go in and numbed up all the spots where we come out. So what we're doing right now shouldn't hurt much at all. It's the entrance sites and the exit sites are all numbed up. So although it looks kind of scary and terrible and painful when you watch it, it's really not very painful at all. Have you been feeling this much when we run the needles under your skin? You probably don't even know when we're doing it. Let me see another one.
Just the pressure a little bit, and that's it. Keep your eyes.
The only thing they usually feel is when we pull those cones through, they more of a sound than a feel.
Why doesn't it hurt underneath the skin?
Well, because we're keeping the needle at a level in the tissue, a layer in the tissue that there aren't many nerve fibers. In fact, if the patient does start feeling sharp pin-pricking pain, then they need to let us know. That means maybe we're a little bit too deep or a little bit too shallow.
So placement is very important.
Of course. For any number of reasons, the placement is very important.
So you're saying if you're in the right level, they don't feel it?
That's true.
Okay, that's what I want to know. Because they seem not to feel it.
It looks like something that they should certainly feel, huh?
Yeah, that's my point. I want to know why she doesn't feel it. So there's no nerve fibers there.
There's cones in there, but there's not many.
So what's the difference between these and PDO? PDO. What's the difference?
Well, these PDO threads are very short threads. They're only a few inches long, and you have to put in bunches of them to get some result. And they tend to not get near as dramatic a result as these longer threads do. And there's some question as to whether or not the PDO threads cause issues with scar tissue in the skin that might make it difficult to do other procedures like facelifts in the future if you run into all that scar tissue formed by the PDO threads. Whereas these threads are actually made out of a filler called Sculptra. And they'll dissolve over the next several months. And then they'll start to behave like Sculptra, which means they're going to start stimulating new collagen production.
So what is Sculptra made out of that makes them have that glow?
Well, it's made out of a product called poly-L-lactic acid.
Yeah, what's that
And
do?
it stimulates new tissue growth. It's what we call a biosynthetic material, which in other words, it creates new tissue.
Okay, so if you were looking at threads in general, why are these your favorite? Because they stimulate collagen and they dissolve completely?
All of the above. Yeah, they stimulate more collagen for sure than the PDO threads do. They get a more dramatic, significant result initially. They last longer than the PDO threads. They're generally much less painful to do. Some people have told me that when they had their PDO threads put in, that it was a very, very painful situation. So there's a lot of good reasons to choose this over the PDO threads if some lift is what you're after and some fill.
So that glow they get after about 6 weeks is just all collagen that makes them have that, what causes that glow that they get?
Well, it stimulates new healthy skin above the area where the threads are placed. The poly-L-lactic acid causes new skin development as well above it, and that new skin is very nice looking.
Well, that's what I see most, and the people are the happiest when they wake up with this really pretty porcelain face.
That might take a few weeks to
That's
kick
like
in,
4 to 6 weeks.
but it's really nice when it happens. And a lot of the extra growth and development and fill that you get with these threads, it takes some time, but it's several weeks. So even it'll continue to improve over months of time.
Well, Dr. Damico, would you say that you're in your happy place right now?
Very much. Sticking people with needles and threads and fillers and toxins, it's great.